Good morning, everyone. Grab your coffee, settle into your morning commute, and get ready for a sip of insight to make your day a little easier and your Medicare knowledge a lot stronger. You're listening to Approved or Denied, decoding Medicare, Medicaid, and beyond for professionals, patients, and providers. Meet your host, Alaniz, RN, certified NLP practitioner, holistic dream life transformation coach, and founder of Just Brook, LLC. She brings over 32 years of nursing experience, including 17 years in discharge planning and utilization review, with a proven record of 0 denials for an entire year in a full-service hospital. Her expertise spans traditional Medicare, Medicare Advantage, and Medicaid, along with hospital-wide utilization review from birth through hospice, SNF, rehab, long-term care, and home health evaluations, and MDS nursing for Medicare and private pay. She is also trained as a Tiles nurse. Cami has opened and operated a home health agency as administrator, served as home health administrator, alternate administrator, director of nursing, and branch supervisor, and founded and ran a physician on-call service, serving 6 doctors, for 3 years entirely on her own. Through this work, she has reduced ER visits, prevented unnecessary admissions, and increased patient satisfaction by directly coordinating care and aligning clinical, administrative, and reimbursement processes. This podcast combines her professional experience with the R3 Empowerment Method, giving listeners the tools to navigate Medicare, Medicaid, and life's challenges with confidence, clarity, and control. Let's get started and empower you to take charge of your healthcare journey. Meet Cami now.
Good morning, everybody. Grab your coffee, settle into your morning commute, and get ready for a sip of insight to make your day a little easier and your Medicare knowledge a lot stronger. Welcome to Approved or Denied, decoding Medicare, Medicaid, and beyond for professionals, patients, and providers. I'm your host, Alaniz, registered nurse, certified practitioner in neurolinguistics programming, holistic dream life transformation coach, founder of Helping People Like Me Ministries, and creator of the R3 Empowerment Method. This podcast was created to bring clarity to confusion, confidence to complex decisions, and empowerment to professionals, patients, and providers navigating Medicare and life transitions. Each episode follows 4 powerful segments. First, we decode Medicare, breaking down what's covered, what's not, enrollment timelines, penalties, approvals, denials, and real-life impact of these decisions. Second, we answer behind-the-scenes questions from patients and doctors, the ones people are often afraid to ask, the situations that feel frustrating, and the why was this denied moments. Third, we spotlight sponsors or guest experts who align with our mission and offer resources that truly support our community. And fourth, we move into the Our Helping People Like Me Ministry segment, where we take life's challenges and transform them into strength and clarity and purpose. Everything I teach, whether it's Medicare decisions or personal growth, is rooted in my R3 Empowerment Method. Move, reset, and rediscover. Because sometimes before you can move forward with confidence, you have to remove and reset. You have to rediscover who you are and what matters before you can live your dream life. And then you rebuild stronger, wiser, and more aligned than before. I created the show not just as a registered nurse, but as someone who has walked through uncertainty, heartbreak, health challenges, and seasons of questioning. I know what it feels like to sit in a waiting room afraid. I know what it feels like to feel misunderstood. And I also know what it feels like to discover that even in the hardest seasons, God was present. If you've ever felt like no one understands what you're going through, I understand. And this podcast is here for you. We have to start with the basics, so let's start learning Medicare from the ground up. Medicare Part A covers hospitalizations. What is covered under hospital stays? Medicare A is hospital coverage. What is covered is hospital stays, skilled nursing facilities, hospice, and some home health services. Premium-free eligibility. Most people get Medicare Part A premium-free if they or their spouse worked and paid Medicare taxes. Important, you must work or be married to someone who worked to qualify for premium-free Medicare Part A. Common misunderstanding, Part A does not cover everything. You are responsible for deductibles and co-insurance. For 2026, the hospital deductible is $1,632 per benefit period. Benefit period means every 60 days. That resets. So if you go in the hospital one day and 61 and discharge and 1 day and 61 days later you readmit, you're going to be paying your deductible again. Amounts increase slightly each year, and there is no cap on Medicare, traditional Medicare. Medicare Part B is your medical coverage. What it covers is doctor's visits, outpatient care, labs, preventative services, and some medical equipment. Eligibility: you can only get Medicare Part B if you qualify for Medicare Part A. Timing and penalties: if you don't sign up when first eligible, you must wait for the annual enrollment period. You've heard it advertised often, I'm sure, AEP. Starting in October, and coverage won't start until January 1st, resulting in permanent penalties. Auto pay is very important. Put your Medicare Part B and any Medicare supplement or Advantage plan premiums on auto pay. Missing payments can leave you with Part A only, which does not cover outpatient services, doctor's visits, or equipment. And if you only have Part A, you do not qualify for the supplement or Advantage plan anymore, so you will also lose that. Personal insight: I've been through overwhelming medical decisions, bills, and stress. I know what it feels like to feel lost and unsure. That's why I'm here to walk you through it step by step. I understand the worry, the overwhelm, the questions, and the fear. I've lived it, and I want to help you avoid the pitfalls that I've experienced. Part C of Medicare is the Advantage Plan. Medicare C, also called Medicare Advantage Plan, replaces original Medicare A and B. I've had so many patients that tell me, I have two insurances. I have traditional Medicare and I have this Advantage Plan. Wrong. You do not have an Advantage. You may have an Advantage Plan, but you no longer have Medicare. Medicare, traditional Medicare, follows rules and regulations. The Advantage Plans also have to allow people to have those same benefits. Does not mean that they have to agree to authorize them. So it's very important. Traditional Medicare, no medical director. Advantage plans, you have a medical director. Many plans offer extra benefits like dental and vision or wellness programs. You must have Medicare A and B to enroll. We'll talk more about Advantage plans, trade-offs, and networks in a future episode. Part D, prescription drug plans. Part D covers prescription medications. Don't skip it. Even if you currently take few or no medications, your needs can change. Late enrollment penalties apply. Late enrollment penalties apply for life if you wait. Enrollment timelines: turning 65, sign up during your initial enrollment period, IEP, to avoid penalties. Still working? Your employer coverage may give you special options. Special enrollment periods are also called SEPs. Apply if you miss your IEP or your initial enrollment period or experience qualifying life events. Initial enrollment period starts 3 months before your birthday, the month of your birthday, and 3 months after your birthday. During that time, and we'll discuss this more with supplements and Advantage plans, you are able to change between supplements and Advantage plans. But with Medicare, when you turn 65, that 1 year of 65 is your golden year, and it will affect the rest of your life. Medicare, on traditional Medicare, you have an 80-20 split. So you're going to go in the hospital, you pay $1,632 for your deductible. Then you're also going to pay 20% of the hospital bill. And anytime you go to an outpatient place, you will pay 20% of the bill. The positives of having only traditional Medicare is you can go anywhere Medicare is accepted because you're not tied to a PPO or an HMO. But we'll talk more about those HMOs and PPOs when we talk about Advantage plans versus supplements. So stay tuned. Next, we're going to go behind the scenes with Kristen. We'll answer some of the questions that providers and patients have in their day-to-day situations in the hospitals. This episode is brought to you by Helping People Like Me Ministries, a place where we empower you to remove blocks, reset, rediscover yourself, and live your dream life. Dive into my book, How Medicare Works, and tools to empower you with Medicare and life. You can get that on my website at www.justbroke.net for the ebook, or if you like the tabletop paperback version that you can take with you to appointments so you can point out exactly what you're talking to and have resources at your fingertips when you're talking to your medical staff, you can get that on Amazon. Also, dive into my Lifetime series to Dream Life. This isn't a guide, it's my story. The challenges I faced, the resets I took, and the journey to realizing God was with me all along. It's real, it's relatable, and it's designed to inspire you to take control of your life. Grab your copy today at www.justbroke.net or the paperback version on Amazon. Links are below. And start your journey today towards empowerment. With Kristen. This is where Kristen will ask her questions, giving listeners insight, clarity, and actionable tools. This episode is sponsored by Helping People Like Me Holistic Wellness. Feeling exhausted, stressed, or running on empty? Your Isoline protein shakes give you 24 grams of high-quality protein, balanced macros, and essential vitamins from organic fruits and vegetables, all without artificial ingredients. Need clean, steady energy? BEA and E Plus provide plant-based caffeine from green tea plus adaptogens to support focus, endurance, and mental clarity without the crash. And if you want to reset your body, the 30-day reset is clinically validated system that supports weight management, lean muscle, stress reduction, and natural detoxification. Fuel your body, boost your energy, feel like yourself again. Visit Helping People Like Me Holistic Wellness today. Hello and welcome back to Approved or Denied. We're very lucky to have Kristen Allred with us today, advanced nurse practitioner and someone I very much enjoyed working with these last few months. She's going to help us with some physician and patient-related questions that come up in real-world situations. So when they come up in your life, you'll know how to deal with them.
Thank you, Cammie. Yes, so I work mostly in the inpatient setting, and a lot of times with my patients, we start with plans and, okay, you've been in the hospital, and now it's time to look at getting out of the hospital. So some of the questions become, okay, well, we can't go home. So Cammie, my first thoughts are, can you give us a very quick lowdown on the differences between an inpatient rehab facility, a skilled nursing facility, a long-term acute care, and a long-term care, just so we can all be on the same page as what type of facility we're talking about?
Absolutely. So an inpatient rehab unit is actually another hospital. So you have to qualify for like a hospital level of care as far as therapy goes. You'll be required to do therapy 3 hours a day. You can start a little lower than 3 hours and work up to 3 hours, but you have to have the potential to be able to do the 3 hours a day of therapy. You will have rest breaks in between, so it's not like you're going out and doing aerobics 3 hours in a row. However, if your patient does have like a severe stroke or something along that nature, then it can feel like they're doing aerobics 3 hours a day because just all the different things they have to do. So in a skilled nursing facility it is required by law that they allow you to do therapy or help you to do therapy an hour and a half a day. And
the long-term acute care and long-term care.
Long-term acute care hospital is when you still meet the hospital level of care, but you've been in the hospital for an extended period of time. They do feel that you still will need that level of care for a while. So there's different criteria you have to meet to go there. But most people don't qualify for that level of care. But for the ones that do, there's definitely that option available. And the last one is long-term care. Long-term care is care in a nursing home, and it's also named custodial. It can also be called custodial care. And that's when you pay either private pay or Medicaid pending, depending on how you go into the situation, where you begin living in a nursing facility, a nursing home.
Gotcha. And Cammie, you said a lot, if you qualify or for the patients qualify. What does that mean?
So when you qualify for like a rehab, there's different criteria. You have to be participating with therapy. You have to have been pretty independent when you got to the hospital. Someone that's been bedbound for say 6 months or a year or 3 years, I'm 100% agree. It'd be lovely if they could walk again. But the idea that you're going to go from that level of care, being able to perform that level of care, to doing 3 hours of therapy a day and walking is very slim. So rehab's generally harder to get into if you have an Advantage plan, and we'll cover this in detail more when we talk about Advantage cares and supplements in the first segment of the show. But if you have an Advantage plan, they automatically deny rehab right off the bat, and then your doctor will have to do a peer-to-peer, and they will also generally deny that, and then the patient will have to do or the family will have to do a patient family appeal to actually get qualified. The reason for that is rehab is very expensive, and it's less expensive to send someone to a skilled nursing facility and still have therapy. So that's the insurance frame of mind in that. The skilled nursing facility, you will need to have physical therapy, need at least physical therapy and occupational therapy. Many times also speech therapy can be obtained there. You'll also a lot of times need wound care or IV antibiotics or additional criteria depending on how strict the Advantage plans are being at the time. Now, traditional Medicare, you can go to each level of care as long as you are able to do therapy for 3 hours a day for the rehab, or the skilled nursing facility if you need PT and OT. That's much easier to get in under Medicare.
Gotcha. Now, I know you said a lot of the insurance in terms of what they will cover. What would be my portion if I was a patient going into one of these facilities?
If you are on traditional Medicare, the break or it's an 80-20 split. So Medicare picks up 80% of the bill. You'll be responsible for 20% of the bill in a rehab and a long-term acute care hospital. And a skilled nursing facility, that's covered at 100% for the first for the first 20 days. You do have 100 days in the benefit, but only the first 20 days are without a copay. Starting on day 21, depending on what insurance you have, you will have around a $230 to $280 copay per day, unless you have a supplement. And you also have to watch the supplements because they're not all created equal. The G or GRFs, the top ones, are the best supplements to have. Then you'd have 100 free days. And the long-term care, that will either be Medicaid pending, which you would have to qualify for Medicaid. You may have to do a spin down, which means if you're over the money level, you may have to pay private pay until you get to the level where you qualify for Medicaid. And then, so that's one option. If you qualify for Medicaid in the community and you go to the nursing home, it takes 30 days to convert you from community Medicaid to nursing home Medicaid. So you definitely have to stay for 30 days. But it does take a little bit of a process, but it's much easier because you already qualify for Medicaid. And the other option is to go to long-term care under private pay, and that will be up to the facility in which you go. Some facilities are like $230 a day. Some facilities are, one of the facilities that I work with, you have to pay $30,000 to $40,000 to get in long-term care, and it's non-refundable.
Gotcha. Okay. What if we can't afford those? What if we say, okay, I fell down, my patient fell down, they broke their hip, they really want to get back to becoming independent, but they're not there yet. And we agree, okay, maybe we can't get into the rehab, but we're looking at the skilled nursing. What if we can't afford those copays? What do we do there?
If you cannot afford the copays and you're at the level where you can probably qualify for Medicaid, what I do is I just call a nursing home that I know does Medicaid pending, and I ask them if they can work with the family, and the family will have to bring in their bank statements for the last 3 months, and they'll have to look to see if they can qualify. If they can, then they can do, and you've talked to the right people, of course, they can do Medicaid pending for their copay. And then after the 30 days, they will have to stay 30 days. After the 30 days, when they qualify for Medicaid, it'll pay those copays back. Then you can go home or you can stay in the facility. Another plus to that is if you do qualify for Medicaid, then you'll be in the facility for 30 days. So you'll get 30 days of treatment. And when you go home, If you have the right level of Medicaid, you can also get a provider, which will help you and your family with the cooking and cleaning, and you'll have someone with you at home for a while during the day as well.
Gotcha. That's very helpful, Cami. Thank you. Breaking those down. That I think would be a nice segue to talk about in terms of, okay, so my patients, let's say you said it's over 400 feet for rehab. What if they still wanted to go? What if they still were, okay, well, I am meeting these distances, but I still really like the idea of getting to go to a facility where I have that help, where I have the extra equipment, the extra physical therapist. What do we do with them?
Well, they can like the help all that they want, but unfortunately, they need to go home with home health if they're homebound, or they need an outpatient therapy prescription. And let's talk more about that next week. Always great to have you with us. And until next time, I hope that all your orders get approved.
Thank you, Cami.
Kristen, thank you so much for those incredible questions. And thank you to everyone listening today. Remember, understanding insurance, whether it's Medicare, Medicaid, inpatient versus observation status, or who pays for the services you, your loved ones, or your patients need, is not just paperwork. It's the patient's health, finances, and peace of mind that we are responsible to protect. If you're a patient, family member, or provider and have questions like the ones we discussed today, email me your questions and they might be answered in a future episode of Approved or Denied podcast. Providers, hospital administrators, case managers, anyone in the healthcare field, including care coordinators, this podcast is your chance to be part of a platform that educates, empowers, and reaches thousands of patients and professionals. We have sponsorship and collaboration opportunities that align your organization with trusted, actionable guidance in Medicare and Medicaid spaces. Message me for details on how you can participate. My email address is Kami, Kami, .approvedordenied@gmail.com. Now stick around because we have 2 more segments coming up. We're diving into getting you even more clarity and tools to navigate the healthcare system and your life with confidence. Don't forget to like, share, and subscribe so this important information reaches as many people as possible. Let's help patients, families, and providers get the clarity they deserve. Let's try to have 1 million viewers. Thank you, and I'll see you in the next segment. This segment is brought to you by Helping People Like Me Holistic Wellness, evidence-based nutritional systems for real-life performance. Isoline Protein Shake provides 24 grams of high-quality protein, balanced macros, and vitamins from organic fruits and vegetables. The 30-Day Reset is a clinically validated program supporting weight management, lean muscle, stress reduction, and detoxification through structured intermittent fasting. Recharge and Add supports cellular energy production and protection using advanced capsule technology for optimal absorption. Whole body wellness solutions for healthcare professionals, patients, and anyone ready to feel stronger and perform at their best. Visit Helping People Like Me Holistic Wellness today. Remember, if this podcast helps you, tips are always appreciated. And if you want to apply to be a sponsor or guest on the show, email me at cami.approvedordenied@gmail.net with your company name, why you would be a great fit, your phone number, a couple of available times to discuss the possibility. We love connecting with sponsors who want to help empower people. Thank you. This segment is sponsored to you by Helping People Like Me Holistic Wellness. Want to glow from the inside out? Collagen Elixir delivers 5 grams of sustainability sourced marine collagen plus zinc and biotin to support skin, hydration, and elasticity. Recharge and Add helps optimize cellular energy production and supports healthy aging, while Aptogen Elixir helps your mind and body. Now, before we close today's episode, I want to shift gears for a moment. You've heard me talk about Medicare. I know that system inside and out. I understand the rules, the gaps, the pitfalls. I know how to navigate it strategically so people don't feel confused or powerless. And somewhere along the way, I realized something. The same way I learned Medicare, I learned how to navigate life. I walked through heartbreak, health battles that nearly took my life, betrayal, moments when I questioned God, moments where I showed up strong on the outside while feeling completely stuck on the inside. And if I'm honest, there was a season when I was functioning but blocked. I was capable, I was driven, but something wasn't aligned. Then I went to Pecos. I decided to spend that year resetting and rediscovering myself. I was going to think about every single thing that had gone wrong in my life because every few months something was going wrong in my life. My entire life, it seemed like there was things that each one I got past and I got through, and I didn't spend any time actually feeling it. I'm not saying that I got through it perfectly because God knows I was in bad moods a lot, but I didn't allow myself to grieve. I didn't allow myself to really just be in that moment, except for my brother's death. That one, I really felt the more sad I was, the more grief I felt. It just meant that I loved him even more, which is not true because there's a difference between grieving for someone and wearing I think it's called like the robe of grief. So there's two different things there that I figured out over the years, and I talk about that in one of my classes. But anyway, I went to Pecos. I decided to just pay attention to everything. I thought I was going to do NLP on myself every day. I was going to watch other people, their reactions, my reactions, what made us click, what made us mad, just different things in the environment, how people dressed, how they carried themselves. And that year I learned so much because I stopped living in autopilot, which was a huge thing I was doing, and I didn't even realize it. I didn't even kind of even know what it meant to live in autopilot. But that year I started really paying attention, and I spent that year resetting, figuring out what upset me. There was someone in my life that I knew I would never ever forgive because I really, really hated him because of what he did to me. But that year, I learned to forgive him. And what I found was that I was more upset with myself because of the actions or some of the things I did because of that situation. And I didn't realize it at the time, but I could blame him and I could be angry at him and I could discipline him every day in my mind. But what I did not realize was he had no idea that was going on. I hadn't seen him in years. The only person that was disciplining was me. So forgiveness is not even actually about the other person as much as it is about ourselves. Anyway, these are some of the things I've learned over the years, some of the things I want to share with you. And anyway, in the quiet moments in Pecos, without the noise, without the pressure, on the way home that Thanksgiving, after I had reset and rediscovered myself, that's when I had my aha moment. You see, God had spoken to me 3 times years before, once after my brother died, and twice when I was getting divorced for the second time from a terrible person. And he said, help people like you. The first time I called the transplant people in Houston because I was sure it was to help with transplants since I'm a registered nurse. But they said no. I've been through too many things with my brother, and it would be way too emotional for me and would not be a good fit. Even though my heart was in the right place, it wasn't the right job for me. And then when I was divorcing this very bad person, I was hanging up the phone with an Allstate investigator, and I heard again, help people like you. I looked around and I was like, God, I can't even take care of myself right now. I have nothing to offer other people. And he said it again, help people like you. And I said, all right, God, when my life is better, I'll help people like me. And I saw myself standing in front of an auditorium full of people speaking. Years went by. I thought about it sometime. I put it out of my mind sometime. And then there was times when I was really concentrating on it, trying to figure it out. But all these different things kept happening. And I would pray and I would say, God, you've told me to help people like me. How am I supposed to do that? So when I was in Pecos, and I had done my reset and I had my aha moment, that's when I realized those years, the things I was still going through in Corpus, it was because I'm supposed to help people like me. So I went through these things so that I can help you. And I even got that verified with Father Jose. And, Catholic priests are very stern in their what they say. So, anyway, I realized after with my aha moment in that year in Pecos, I realized I wasn't broken. I was carrying weight that was never meant to define me. I wasn't lost. I had simply forgotten who I was and underneath everything. That's when I reset. That's when I rediscovered myself. That's when I realized God had been there the entire time, even when I thought he was silent. And in that moment, everything changed. It became the foundation of my R3 empowerment method. Remove the blocks, reset your foundation, rediscover who you truly are, and live your dream life. Because you are not broken, you are blocked, and blocks can be removed. That's why I created Helping People Like Me ministry, because I know what it feels like to sit in a room full of people and still feel alone. I know what it feels like to be strong, to be the strong one, and secretly wish someone would be strong for you. And I want to hear you clearly. I want you to hear me clearly. I hear you. If you feel stuck, I hear you. If you feel overlooked, I see you. And if you're exhausted from holding everything together, I understand you. And I know how to get you through it. Now, let me tell you something personal. People often ask why I named my company Just Broke LLC. When I was in NLP school, I worked frequently with Fidel. One day he said, "There's a part of you that holds everything together. You're a single mom, you start businesses, you say you're going to do something, even when it looks impossible, and you do it. Nothing stops you. You're like a freight train." He said, "Instead of listing all those adjectives, let's give that part of you a name." I said, "Brooke." He asked, "Does Brooke have a first name or a last name?" And I said, "Nope, just Brooke." That name represents my inner strength, the part of me that doesn't quit, the part that figures it out, the part that carries love and confidence no matter what. And when I had my aha moment in Pecos driving home that Thanksgiving, I knew instantly that would be my company name, Just Brooke. Because there's enough love and confidence in me for people I serve, especially in moments when they can't feel it in themselves. When we work when you work with me, you borrow my certainty until you remember yours. And here's what I know about you. If you're still listening right now, something inside of you is ready. Ready to stop replaying the same patterns, ready to stop doubting yourself, ready to stop carrying silent weight. You don't need more information, you need activation. That's why I offer structured pathways forward. I have two book series. One's a medical collection, and the other is my Dream Life collection. My online courses built around the R3 empowerment method, my one on one coaching for deeper transformation, and ministry resources designed to walk with you spiritually and practically. This is real world. This isn't church. This is real people, real world. I truly understand. This isn't surface motivation. This is strategic transformation. And I don't let people fail. So if something inside of you is stirring today, don't ignore it. Go to my website, www.justbroke.net, JUSTBROOKE.net. Choose the program that fits where you are right now. And let's move. Because the way I help people confidently navigate Medicare, I will help you confidently navigate your life. You are not alone, and you don't have to figure this out anymore. If you wonder about the things I've been through, if you wonder how I started to make my way out of them and live the life that I want to live, read my book, my Lifetime series, The Dream Life. I promise you will understand that I understand you. Thank you for joining me on this episode of Approved or Denied, Decoding Medicare, Medicaid, and Beyond for professionals, patients, and providers. Don't forget to check out my ebooks on my website, www.justbroke.net, JUSTBROOKE.net, or my tabletop paperback on Amazon. And join the ministry to continue learning, growing, and living your dream life. Tip generously if these episodes help you And stay tuned for our next episode where we dive deeper into Medicare, Medicare Advantage plans and supplements, networks, and trade-offs. I'm Cami Alaniz, reminding you that you can remove blocks, reset, rediscover yourself, and live your dream life. Until next time, may God bless you and may God bless America. Bye-bye.
Thank you for joining us today on Approved or Denied, decoding Medicare, Medicaid, and beyond for professionals, patients, and providers. Remember, you can explore Cami's books, courses, bundles, and classes at www.justbroke.net to empower your Medicare knowledge and life. These resources are designed to help you remove blocks, reset, rediscover yourself, and take control of your healthcare and personal journey. If this episode helped you, tips are always appreciated. And stay tuned for our next episode, where we dive deeper into Medicare Advantage plans, supplements, networks, trade-offs, and behind-the-scenes information. Cami Alaniz reminds you that with the right tools, guidance, and faith, you can navigate life and healthcare with confidence, clarity, and empowerment. May God bless you. God bless the USA. Until next time.